Wikipedia is this incredible resource for us. It's one of the most popular sites on the internet for people to access healthcare information. We know that from recent research, the majority of physicians in the United States use Wikipedia to access healthcare information. My name is Dr. Robert Hasty. I am Regional Associate Dean for Campbell University Jerry and Waugh School of Osteopathic Medicine. I'm also Vice President of Medical Education at Southeastern Health in North Carolina. And I'm also the lead author on this month's article in the Journal of the American Osteopathic Association, which looked at this, looked at whether or not information in Wikipedia for common healthcare conditions was accurate. We took the top 10 most common conditions in the United States that range anywhere from cancer to heart disease. We compared this to standard peer-reviewed references. What we found was that there was a statistically significant difference when you look at peer-reviewed reference versus Wikipedia for errors to be in Wikipedia. Most of the errors were relatively minor. They included statistical differences, but some of them were significant. So, for instance, blood pressure is the most common condition in the United States. In Wikipedia, it said that you had to check blood pressure on monthly intervals for 3 consecutive months to make that diagnosis. According to US guidelines, currently, you only have to check it twice. So theoretically, patients could be less timely diagnosed or treated for the most common condition. I think from a patient perspective, they should look at Wikipedia as a resource, but they should also consult their physician, as well as looking at other websites, which includes the Centers for Disease Control, Department of Health and Human Services, and peer-reviewed references. For physicians, I think obviously we need to make sure that we are not using Wikipedia for authoritative guidance, and we should also be part of the community, making sure that the Wikipedia articles that our patients are reading are the highest quality and most accurate, and engage ourselves in the editing process. So with that, thanks for having me. Appreciate it.